Welcome, folks. This is Doug McCall from the International School Health Network. Welcome to our repeat session for this webinar today. We had an excellent session yesterday, or for people, our presenters, actually the same day. It's now 2 o'clock in the morning for our presenters, and they started their day with a webinar at 8 o'clock in the morning. So they're almost on a 24-hour clock. So we really appreciate their commitment to this session and to school health. The purpose of this session is to look at the Health Promoting Schools program that is operated in New Zealand, and we're looking forward to learning about that and about the very interesting results of their program as it connects to educational achievement and attendance. As indicated in the session description, this session is part of a series we're just starting up, looking at what we're calling the new strategies or new dimensions for school health promotion, and one of those strategies is to integrate more effectively within education systems. And so we're very pleased to be learning about this excellent example of how that's done effectively. So I'm going to just introduce very briefly our three presenters today, and then turn it over to those folks to be able to walk us through the presentation. As we go through the session, if you have a question or a comment, please type it into the chat box, and we'll come back to it after the presenters have finished their remarks. Yesterday we ended up stopping at periodic points and asking for questions or comments. So, Therese, I'll leave that up to you in terms of pacing the presentation as you see fit. But so we'll do that today as well. We have with us today Donna Wind, who is part of the research team that put together the report that you're going to hear about today. We have Therese Ireland Smith, who is the manager for the New Zealand Health Promoting Schools program, part of the cognition education consulting firm that manages that program. And we have Annie Davey, who is the manager of communicable diseases and healthy environments in public health, and is the manager for the school health program in the Ministry of Health. And without further ado, I'll ask Therese and Annie to start up the presentation.
Kia ora and warm South Pacific greetings to you all. As I said earlier in the day for you, is that we do come from New Zealand, and I and Donna do have accents, and I do know from my children that in the other parts of the world it can mean that you may feel like you want to fall about laughing. So please do, we enjoy making you laugh, but sometimes there may be words that are unclear, so please ask me to stop or to clarify. There is two words throughout the presentation that I'll explain now. In New Zealand, when we talk about whānau, and the word is spelt W-H-A-N-A-U, the word whānau means extended family, so it means a child as well as their parents and members of their family. The other word is when we talk about agency, and when we talk about agency, we're talking about having the ability to influence decisions, having a say, having a voice. So those are two words that are used throughout our description of our approach. So today we'd like to start off with Annie Davey, who manages this contract, the Health Promoting Schools, what we call Health and Wellbeing for Learning for New Zealand. She is with the Ministry of Health, and I'll get her to start and describe to you, give a very big overview of what the Ministry of Health and Wellbeing for Learning looks like within New Zealand.
Hello, good morning and good afternoon for some other people. Putting it in the United Nations context, I act like the country manager for health promoting schools, and I am in charge of monitoring the performance of health promoting school service across the country. Therese, in many ways, is the country manager for health promoting school service as well nationally on the side of the contracted provider. And Donna is our researcher as well as now our data manager who provides me with data from time to time when required, especially by the government or the Minister of Health. Just like in other countries, the Ministry of Health is the principal advisor to the New Zealand government on health and disability matters. And the Ministry of Health is also a funder for health and disability services. Part of the ministry's role is to procure health and disability services from different health providers or entities, which include non-government organizations, companies like Cognition Education Limited, represented by Therese and Donna, and what we call district health boards. District health boards in New Zealand are responsible for funding the provision of health and disability services within their own district. There are 20 district health boards in New Zealand, and the district health boards are expected to have an understanding of the context of their own district so that they are able to set the health priorities and start addressing those. So for this slide, you will note that there are managers for different contracts. The district health boards have public health units, and the public health units are in charge of providing population health services to their district. The population health unit deliver one big contract called public health contract and another smaller contract which is health promoting schools. The two contracts used to be one. However, in 2013 and 14, the funder had decided to separate health promoting schools from the bigger portfolio of contract to ensure that the funder is able to monitor the country performance, as well as to observe patterns in terms of service delivery and the achievement of outcomes. So the funder had observed that there was a bit of confusion in terms of health promoting schools and the larger health promotion aspect of the public health portfolio of contract. You will note by looking at this slide that the health promoting schools providers are divided into two. We have 15 district health boards, and the 15 district health boards cover 20 districts. They are the local providers for health promoting schools, and they are the ones in direct contact with schools. And on the right, we have the National Leadership and Coordination Service under Cognition Education Limited, and Therese and Donna represent the National Leadership Service. The National Leadership and Coordination Service is in charge of providing professional learning and development to the workforce of the 15 district health boards, as well as managing data collection, data analysis, and data reporting to the Ministry of Health, and managing the health promoting schools pages of the Ministry of Education website. As you will note, the district health boards are in direct contact with schools, and in a new landscape within education, the communities of learning, or we call them kahui ako in New Zealand. If I may mention, the funding per year for health promoting schools that's to fund the 15 district health boards and the National Leadership Service, is 5 million New Zealand dollars, GS tax exclusive. We understand through training in public health that there are 8 health promotion strategies. In the context of health promoting schools or health and well-being for learning in New Zealand, we mainly utilize the community development strategy, although there are aspects of the other 7 strategies that are enmeshed within how we affect health promoting schools. We are largely using a purist community development approach. So within the New Zealand context, health promoting schools is not the same as health education or generic health promotion in schools. Health promoting schools, as I've said earlier, is a contract separated out from the bigger public health contract. Within the bigger public health contract, we have health promotion in schools. And as I've mentioned earlier, the district health board are in charge of providing population health services to their district, and included in that is the provision of health promotion. We distinguish between health promoting schools, health and well-being for learning, and health promotion. Therefore, there are expectations of different skill set for the workforce. I have to add and mention, however, that a challenge for the funder for the last few years has been that the providers for health promoting schools as well as health promotion in schools are the same entities, being the district health board. And we have instances where the workforce for health promoting schools is also the workforce for health promotion, because some of them work part-time as health promoting schools facilitator and part-time health promoters. To make the distinction even clearer, we had to spell out the difference in skill set. So one of the key skills needed for health promoting schools facilitator is that of critical questioning or inquiry. As mentioned earlier, we utilize primarily the community development approach. Therefore, we had to create a community development taxonomy to enable our facilitators across the country to understand where does their work begin and where does it end. And we understand that community development is about having a clearer understanding of power, being able to kind of analyze it, and to create shifts in power dynamics. So as you will note on this slide, on the left-hand side, it is our expectation that when a school begins its health promoting schools journey, our facilitators are conduit of information. But as the journey of the school progresses, we will see a shift in power holding, and we will see the school having more of that, and then ultimately power rests with whānau and community. So the pyramid shows to you and to our facilitators the journey that has to happen, so that we can see whether we are influencing shifts or not. And we have the 4 levels of the pyramid, and those correspond as well to the health promoting schools levels for the different schools. So we have level 1, 2, 3, and 4. And those correspond as well with the rubric, and Therese will give you more information about the health and well-being rubric later on. We provided you with a link to health and well-being for learning in action by featuring one of the schools that had been actively engaging with our health promoting school service in the northern part of New Zealand. When the funder looked at health promoting schools and to ensure that the results are better than what they were in the past, we deliberately look at this particular statement by Lawrence St. Leger. And of course, because of the statement that the health sector had largely ignored the vast literature on schools, we did not want to be accused of that. And so in New Zealand, we deliberately paid attention to this and progressively rejigged or rebooted the service design of health promoting schools. So the Ministry of Health and the National Leadership Service, particularly Therese and in her team Donna, have helped us create a different model to health promoting schools to other models in the world. The challenge for me as a lead for health promoting schools or country manager in the context of kind of United Nations language has been to influence my colleagues to look at health promoting schools as a philosophy rather than a program. It's an approach, and that approach has to not solely look at health per se, and not to look at health as a narrow perspective. Rather, it is a very broad contextual concept, and that the expectation is that we see the marriage of health and education, and along with that, social services. Therefore, the New Zealand model of health promoting schools is one that has coherence across education, health, and social services, and of course, that sense of agency for our whānau. Part of what we had to look at is the logic for health promoting schools. In a previous International Union of Health Promotion and Education conference, they look at this illustration, because we know, and it is often a criticism of health promotion, that the health promotion is full of activities, but at times the activities do not necessarily lead to the result that are intended, if there are intended result at all. And there seems to be an expectation that something is missing, but that the result will still happen as people perceive them to be. So for New Zealand, we had to deliberately ensure that the activities would actually correspond to a desired outcome. And that meant identifying where we're starting from and identifying or naming the result we want and how we will achieve that particular desired result. Is there any question at this point?
Yes, please, if you can just click on your mic or take yourself off pause on your telephone.
Sure.
Be happy to take questions at this point. I had a comment, and maybe it's just an opening up for later discussion, but as I've indicated earlier, we're trying to move towards a systems approach, and a couple of the elements of that, a big idea of systems is working within a context, and so having programs being less important than what the people in the context want to do, what they'll want to achieve is an important principle. And then also structures in terms of how it's delivered are very important. And so the discussion of how the health promoting school service is separate from other activities of the Ministry of Health is a very important consideration. If we're looking at systems, we need to understand how governments and bureaucracies work and shape things, and shape agendas. So those are two thoughts that I had. And please jump in if anybody has a question for Annie, setting the stage for some of the program elements and some of the results. If as we move forward, if you have a question, please just type it into the chat box, and we'll come back to it as we proceed through the presentation. Thanks.
One of the advantages of separating the health promoting schools contract from the bigger public health contract is that it enabled us to follow the data, and by having the data, we're able to kind of really observe patterns. And without having separated the data, it would have not been possible for us to share with you today the result of the structural equation modeling.
Excellent. And data, as we know, data is very important to making things happen within governments.
Yes. Thanks. Over to you, Therese.
Okay, there's a question here from Anthony. Definition of term there. Can you just explain that one? If you're seeing it on your left-hand side of your screen.
What our government has done recently in the education area is they are requiring New Zealand schools to become part of a collective in their area, in their region, and they're calling those, they did call them communities of learning, and now they're calling them kahuiako, which means the same thing. What the intention is that one school or the kahuiako will identify a school leader as the leader of the coal or kahuiako, and that collectively that they will identify, they will use the data that they all have around student achievement, and that they will identify what their achievement challenges are, and collectively they will identify actions that they will take and measurements that they will use to address the achievement challenges that they have.
Super, thanks, Anthony.
Thanks.
So I'll just pick up where Annie's left off. This diagram actually came from an IUHPE conference in July 2014, and we've used it a lot because for us it aptly described the situation that we arrived at when we came into health promoting schools in 2010, and that there was a whole lot of activity happening, but there was no clear direction in terms of what kind of outcomes people were looking for, and also what kind of actions are most likely to achieve those outcomes in an education setting. This was also complemented by the Wiley report, and in the PowerPoint that I've shared with Doug and that he will make available to you, I've actually PDF'd it and I've put in the notes, and in all of the notes I have links to all the research and evidence and also case studies that you can use and the resources, because part of our role as the National Leadership Service is also to develop tools and resources for the workforce. So there's links to those as well throughout the presentation. So one of the pieces of research that was done in 2014 looked at health promoting schools. It was a meta-analysis, and they concluded that there were few studies included any academic attendance or school-related outcomes, and that given the paucity of data, it is not possible to determine the impact of the HPS approach on academic or attendance, or both. So what we wanted to do is that not be the case for us. We wanted to be able to show that we were contributing to educational outcomes, and in fact, it has been crucial in the education sector's uptake and acceptance of the health and wellbeing for learning approach, and that we have been able to demonstrate that we are able to contribute to them being able to achieve their educational outcomes. And part of that was also looking at what kind of conditions did we need to create in order for change to happen within an education setting. And so we drew on the vast literature that is within both education and health that tells us what conditions we need to create. And one of those conditions we know is collective impact. And John Hattie, who has done a lot of research and has a great evidence base within education, identifies that collective impact is the number one effect size. It's the most significant way in which you're going to be able to affect change within an education setting. And in the notes I've provided you with, I've given you a link to his research and evidence. The other thing we needed to look at too was that New Zealand, by comparison to other parts of the world, has quite a unique context, as indeed yours will be too. In terms of New Zealand, we're geographically isolated. Our schools are used to working in national clusters and networks. We also have a very diverse school population, particularly within the Auckland area. The other thing that separates us from other jurisdictions throughout the world is that we have a treaty with our cultures called the Treaty of Waitangi. And under that treaty, it is a formal agreement, and the agreement basically states that Māori, who are our Indigenous culture, enjoy a health and education status at least as good as non-Māori in both health and education and in social circumstances, and that all these sectors are expected to demonstrate their commitment to this through policies and practices that they promote. And indeed in New Zealand schools are required to report how Māori and Pacifica Indigenous populations are faring in terms of educational outcomes and what they are doing to improve that. The fourth point is also of interest because New Zealand has probably the most evolved form of education provision within the world. New Zealand schools are self-governing. This means that they're autonomous and responsible to their local community, and that developments of the curriculum are at best devolved so that although we have a national curriculum, schools are expected to look at the curriculum and craft that so it delivers to the needs of the particular population in their community. So the self-governing schools was driven by a desire for flexibility and responsiveness and a belief that the local school community knows best. The other part of that is also we have drawn on the evidence-based inquiry approach, and that draws from the understanding that for learning to happen, education needs to be transformational, not transactional. So by transformational, what we mean is that in order for learning to happen, we have to change the way people think. We have to change their set of beliefs before their behaviour changes. So within New Zealand, the curriculum and the expected best practice for teaching is very inquiry driven, as is the leadership of education within the education setting. Inquiry drives the self-review processes within a school. So central to anything that happens within a school in New Zealand is inquiry. The last point is also the whole school approach. And when we looked at the vast literature on health and wellbeing for learning, there was a talk of a whole school approach, but there was very Spartan description of what people meant by that. What we mean by that in New Zealand is that we mean and see the school as a system of interconnected parts. We also see a whole school approach as talking about the process of change that is more likely to lead to improved outcomes. And what the evidence shows that process is inquiry, where the people who are delivering and receiving the educational experience are the ones that are driving the inquiry. Also within our context, the New Zealand Health and PE curriculum is a holistic approach to health and wellbeing. And it is based on Te Whare Tapu Whā, which is an Indigenous holistic concept of health and wellbeing, which in New Zealand is, the Māori term for that is hāora. And what that Te Whare Tapu Whā sees hāora as being that you need, and the allegory is a meeting house, is that you need all the walls, and you need, in order to hold up the roof or ceiling, and all parts need to be present if you are to have and sustain hāora. So what they see as the parts are that you need psychological health, spiritual health, physical health, and family health, because within Māori concepts, a child does not exist outside of a whānau, outside of their family. So it is the whānau which is central to health and wellbeing for learning, rather than just the individual child. So this diagram here is basically our theory for change, and what we did is we brought together all the learnings that we have from research and evidence in both health, education and social services around what conditions need to be created if we are to get change and indeed accelerated progress, particularly for those who most need it within our systems. And on the left-hand side, you'll see we have a very good understanding, I know, within New Zealand and other parts of the world, and I know Canada has been a contributor, as well as other parts of the world, to effective teaching and learning practices and what that needs to look like. We know a lot about that, and we can give very precise descriptions of what practices teachers and school leaders need to create and need to do if they are to get change happening and accelerated progress for students. We also know within New Zealand in particular, and there's a big body of research that was done by Russell Bishop and Mary Berryman, and that project was called Kotahitanga, and it spanned over quite a number of years with a huge data set. We know that school leaders and teachers need to have educationally powerful relationships with students and their whānau as well. And they're not just relationships, they're educationally based. So we know when you have that and effective teaching and learning practices, as well that is being guided by strong and effective leadership, that student outcomes improve, particularly for your minoritized groups. And what we've called our outcomes, we use the acronym AREA: attendance, retention, engagement and achievement for those students increases at an accelerated rate. What we also know, and we have a body in New Zealand called what the acronym is ERO, and it's the Education Review Office. And they are an individual body who review what is happening within our schools and within our kahui ako. And they have recently done quite a bit of research and evidence that they've drawn on international research and evidence as well as local research and evidence around health and wellbeing and agency, and how that relates to and influences outcomes within a school. So what we also know is that when you create the conditions for effective teaching and learning, where there is strong leadership and educationally powerful relationships with whānau, we also know that the health and well-being and sense of agency of students and their whānau increases. And in effect, this diagram represents our theory for action. We know that the powerful role of well-being and agency plays in improving outcomes. And so the diagram was originally one that had come out as Kotahitanga research and evidence, but we have basically tutted around the edges so that it now speaks to our theory for action. In the notes I've provided you, you'll see that I've also provided you to links to all the other research that has influenced this diagram. So within this new construct of health and wellbeing for learning, what do we offer? So basically our facilitators offer school communities free support. We offer them links to resources and to services. We also offer a highly effective tool, and what the tool does is that it deliberately allows schools to review what they are doing within effective teaching practices, educationally powerful relationships, leadership, health and wellbeing for agency, and student outcomes, and how well health and wellbeing constructs have been integrated across those areas of practice within their school. The other thing that the rubric does is that it looks at how well power, i.e. agency, has been distributed throughout the school community. And on the rubric there is a scale that ranges from 1 to 4, and what you can see is as you see the rubric, you'll see that by the time a school is getting to the top of the rubric, the far right hand corner of the rubric, they are operating at a level 4, whereas a school that is just beginning the process is at level 1. So you can see the rubric tracks from left to right, and what it's tracking is from 1 to 4 on the taxonomy in terms of the descriptors. So it's very hard for a school to get beyond the most basic level unless the school leaders are beginning to grow the sense of agency, that is the ability to influence decision making within a school, for both students and whānau. They can't really get beyond the most basic levels. Whoops, I'll just go back a bit. So the rubric is also proved to be a highly effective tool. When we also did the structural equation modelling, we found that it was a huge predictor for how well a school was going in terms of improving outcomes. The rubric, we also have found when we've used it with schools, has been extremely useful for them because we deliberately aligned it with the Education Review Office performance indicators. And you'll see that the headings that we've used are the exact same headings that the Education Review Office within New Zealand has used to monitor and evaluate how well schools are doing in terms of improvement and outcomes for students. So it looks at process indicators and outcome indicators, and we have replicated those within the rubric. So when schools see the rubric, they immediately understand that it is useful and that it is talking to their context. The rubric has also, we have adapted it so it can be used across kahui ako, so they can use it as a tool to scope, track, monitor and evaluate health and wellbeing and educational outcomes, not just in each school but across the kahui ako, and they've found that very useful. In my notes I've provided you with a link to our rubric as well as to the rubric calculator, which shows you how you can input information, the scores, and what it does is that it will give you an average across each of the domains, and it gives you at the end it will provide a graph of results for you. The other thing that we offer schools is that we now have very strong evidence that if you use the tools and the HPS inquiry approach, you are more likely to get significantly better outcomes in terms of attendance, retention of your students, and what we can also show at the moment is improvements in reading. So one of the questions that begs is, well, if this is a new approach, what is it that facilitators do? Obviously, at the beginning, it is about building a trust relationship with schools, but this is very quickly achieved, we find, when we use the rubric as the basis for a conversation with schools around what is happening within their context, what they are doing well, and where their challenges lie. And it is also extremely useful in pinpointing where it is that they have data or evidence and where they don't, and where they can begin their journey in terms of identifying a priority area for action and planning that action. So the bulk of a facilitator's role falls within step number 2, that they're in frequent contact and supporting schools to gather staff, student and family voices, unpacking and or explaining evidence, identifying desired outcomes, linking to resources, driving action and monitoring and measuring progress. And where the rubric comes in handy is it is an extremely useful tool for number 1 and 2, and driving and tracking your journey. At number 3, they are progressing along the levels of inquiry, and we have the levels of inquiry which track the taxonomy from 1 to 4. And number 4 is that what we're looking for is clear outcomes and evidence of agency, so that when they're tracking against the rubric, you'll see that as they're tracking from left to right, one of the things they're doing is they're gathering evidence, that they are gathering the voices and they're acting upon those voices, and their plans reflect the voices and agency of their school community. One of the tools that we've had to provide for our facilitators is that their role is now not that they are there to deliver an agenda on behalf of the District Health Board, but rather they are using critical questions together with the tool, the rubric tool, to help surface the beliefs and thinking of the school and the school community, and how they are going to identify what their, where their challenges lie, and really honing in on what it is that they need to be doing or identifying as their first steps, where to next, and how they're going to get there, and what evidence they're going to use to monitor what identify their desired outcomes, and what measures they're going to use along the way. So those are new skill sets for our workforce. We run a series of workshops throughout the year on critical questioning and how to have challenging conversations with school leaders. And in fact, they were really quite reluctant or hesitant at the beginning, but when you use this alongside the rubric, what they have found is that, and been surprised at, is that it is readily accepted by schools. And in fact, our research, and it mentions this on the left-hand side, we do a school survey every year, and we ask schools about the facilitators, and in the schools where the facilitator had used the rubric and had used critical questions alongside that, that is where the schools were far more likely to recommend health promoting schools, and they spoke very highly and commented on the use of critical questions, or the role of the facilitator as a critical friend, as being a key driver for them to effecting change within their school community. So the evidence I talked about, and I'm going to give a little bit more detail about, was that we contracted an independent evaluator to look at very large data sets for us, and to identify if our approach was effective. And in fact, the evidence we've got and that we can share with schools that it is effective shows that it is highly effective, this approach, the tools as well as the inquiry-based approach. So that in schools who are using the rubric and are tracking against the inquiry, 60% of attendance improvements are explained by their involvement in health and wellbeing for learning. 42% of the decrease in student stand-downs and suspensions are explained by their involvement in health and wellbeing for learning approach, and students' reading performance in HPS schools, or health and wellbeing for learning schools, was 29% higher on average than those who were just doing health promotion or were not involved at all with the health and wellbeing or HPS service. And in my notes, I've given you a link to the summary report for that. The next slide just puts into words, into simple words, what the structural equation modelling, or the summary of the evidence of success of the approach. What the analyst also did, or evaluator also did, was she was able to identify the 4 critical success factors to creating a community that maximises positive student outcomes from the structural equation modelling. So what she found is that the Education Review Office in New Zealand, when they review a school, if a school is having significant challenges, they are put on a 1 to 2 year cycle. If they are doing pretty well, they're on a 3, but if they're really humming, they're on a 4 to 5. So what we gained from the Ministry of Education was we were able to talk to them and get huge data sets from 2013 to 2016 for all New Zealand schools, not just those in the HPS service, but all New Zealand schools. So the data that they were able to provide us was attendance, stand-down suspensions, and also the outcomes in terms of achievement within national standards. So that is for our primary aged students. That's in years 1 to 8. We use that data set because traditionally health promoting schools had targeted years 1 to 8, but however with Kahui Ako, we will now be working across into our secondary, which is the years 8 to 13. So we will be using, when we do the structural equation modelling next, we will be looking at our data sets achievement rates for our secondary students as well. But for this study, we were looking at the national standards, which is year 1 to 8. And so what the data showed us, and what the structural equation modelling showed us, is that when you have a school that is doing reasonably well to doing really well, so they're on a 3 to 4 to 5 year Euro cycle, what she was also able to identify is if those schools were also focusing their efforts and their change action on the rubric dimension, leadership on equity and for equity and excellence, or educationally powerful connections and relationships, those were significant drivers for improvement. She found there was a strong relationship between those schools that had identified those areas of practice for improvement and improvements in attendance, stand-downs and suspensions, and reading. She also found that there was a strong relationship too with the quality of the facilitation and improvements in attendance, stand-downs, suspensions and reading. And of course, within our approach, the ones that we drive within health and wellbeing for learning are the rubric, because that's the tool we use, and the facilitator as a critical friend alongside the rubric. Those are the two things that we provide schools with. And as you'll see, as I go into the structural equation modelling, unfortunately Dr. Heidi Leeson couldn't join us. She is travelling at the moment. So I'll try to do justice to her research, but again, I've provided you with a link to her analysis report, and I've provided links also to a description of what structural equation modelling is, and I'll try to give a layman's version of that, and hopefully that makes it a little bit clearer. So I'll just move on to the structural equation modelling now. So hopefully this has given you kind of a big picture. But for us, this was hugely exciting, because what it showed us is these are the things that we are providing to schools, and it's showing that there is a significant relationship between those particular aspects, the tools and the quality of facilitation and improvements and outcomes for students within those schools. So structural equation modelling is a methodology for representing, estimating and testing a network of relationships significance between different variables. So it's testing the relationship between variables. So what were the variables that we used? So in terms of the variables we went to our school survey and we looked at the quality of performance of the facilitators. We were able to identify what quality facilitation looks like and who those facilitators were and which schools they were working in. We were also able to, within our database, able to look at the schools who were using the rubric and what dimension they were focusing on. And we were also able to identify, because we have this in our Health and Wellbeing for Learning database, what level of inquiry the schools were at. The Ministry of Education was able to provide us the ERO cycle of schools throughout New Zealand as well, so we were able to input that data. The other set of data that we were able to use was the data that I mentioned earlier, was that we were able to look at the data provided by the Ministry of Education for the 2,529 schools in New Zealand, and the data sets were really big, and Donna had to manage this beast. It was the data from 2013 to 2017, and that was the data for attendance, stand-down suspensions and transients, and academic achievement. Unfortunately, the transients data was incomplete and we weren't able to use that, but we were able to use all the other data sets. And what Dr. Heidi Leeson was able to do was to use a methodology called structural equation modelling, which looked at what was the relationship between all of those data sets and which ones showed that there was a significant relationship. So it must be cautioned here that what structural equation modelling does not do or infer is a causal link, but it does show that there is that they contribute to. It doesn't show a causal link. So it's contribution, not attribution, that we're looking at here. So what the data found, as I mentioned earlier, is that 60% of attendance improvements could be explained by a school's involvement in the HPS or Health and Wellbeing for Learning approach. That is, they were using the rubric, they were moving along the inquiry cycle and had a really good facilitator. 42% of the decrease in student standards and suspensions in those schools could be explained to involvement in Health and Wellbeing for Learning and HPS. And students' reading performance in those schools was 29% higher on average than in those that were either just doing health promotion or were not involved at all in the HPS service. Now these series of slides show and give a number which shows the level of significance in terms of how strong the relationship was between the improvement rate and the particular variable that we were looking at. So if we look at this first diagram, when we look at the 0.5 indicates that there is a relationship. By the time we're getting to 0.81, it's a significantly strong relationship. So the values indicate whether there is a relationship and how strong that relationship is. So you can see when we're talking about improvements in attendance that there was a relationship definitely between attendance and how well, whether the school was on a 3-year or 4 to 5 year ERO cycle, which makes sense that they were a school that was running reasonably effectively in terms of their practices and processes. But we also, what was surprising to us was how strong the relationship between the rubric levels, particularly those two dimensions, the leadership for equity and excellence and educationally powerful connections and relationships. And in fact, when schools were concentrating their efforts for improvement through educationally powerful connections and relationships, through all of these 3 slides, you'll see that this is the strongest. The facilitator or quality of facilitation was also, there was a strong relationship between that and the improvement rates in attendance. So again, we're not saying there was a causal link, but it was certainly, there was a strong relationship. There was a contributing factor. in this next slide, what we're looking at is the rates of stand downs and suspensions in those schools. You can see that the arrow cycle is not as strong, but again, you can see that when a school is concentrating on those two areas and those of our rubric, particularly educationally powerful relationships, that was a really strong driver for improvement rates in terms of stand downs and suspensions. And actually there's quite a bit of logic around that as well, because whānau are an important part if you want to improve student engagement with school and their ability to stay within the school system. Then I think whānau are a particularly important part of that picture. And again, you can see the facilitator was a factor there, but not nearly as strong as the educationally powerful relationships. And in the last, we were looking at reading, and for some reason, across our data sets, because we also had data for math and writing, but it was reading where there was this strong relationship between the schools that were engaged with the health and wellbeing for learning approach. It was the reading that showed the significant relationship. So again, there is a strong relationship, and you would expect to see so, between the effectiveness within the school. So the effectiveness of the leadership of quality teaching and learning would be a significant driver, you would imagine, to improvements in reading for schools. But what was also surprising was how strong the relationship between educationally powerful, those schools that were concentrating on educationally powerful relationships, and that contribution to improvements in reading. But again, when you look at the research and evidence around improving reading for children and young people, whānau again play a powerful role. Reading at home, a language-rich environment, because students spend most of their time at home. So when schools are able to have educationally powerful relationships with whānau, where whānau are also seen as creating the conditions for learning and powerful partners in learning, then that would be a powerful contributing factor to improvements in reading. It's not surprising, though, that the role as a facilitator is not nearly as significant here, because the conditions for creating the conditions for improvements in reading are largely within the school sphere and largely within the conditions created within the home. So from all of this, you can see the rubric became a really powerful tool for us, and the evidence that Dr. Heidi Leeson provided us.
Therese, just before you leave that section, Anthony had a question, and I just asking
Sorry.
Anthony, can you say more about the 60% increase in attendance? Anthony, was your question answered in that last section?
Yeah, I think it subsequently was. Yeah, thanks very much.
Okay, thanks.
So the health and wellbeing tool, as I mentioned earlier, has got 6 domains. And the first one is an outcome indicator. The rest are what the Education Review Office term process indicators. So those are the processes and practices within a school. And we have deliberately used exactly the same wording and heading and language within our rubric that is contained within the Education Review Office performance indicators. But what we have done is we have integrated health and wellbeing and agency across all of those indicators, and it tracks like a rubric, and within education, educators are really used to, and in fact probably well over, rubrics. They use them all the time. So when our facilitators arrived with them, although it was new for the health sector, it certainly was not new for educators. They were able to navigate their way really quickly. And I've provided for you a link so you can go and see where the rubric is, and also the rubric calculator. I've also provided you with a link to whānau school, and they show you how they used the rubric to basically, as a new principal coming in, she used it to track where she was at and where she needed to go next, and how they and the innovative way in which they activated student and community voice and used it as a basis to develop the whole charter, which included their curriculum. So that story is there for you to access. So the health and wellbeing rubric is a self-review tool, and it describes the degree to which health and wellbeing practices, processes and outcomes are integrated into the school culture. So it's that whole school approach, and contributes to improved student and health and educational outcomes in the school community. So that's what it does. So the health and wellbeing self-review tool includes evidence-based outcome and process indicators that allow school communities to think about their current practice and evidence, to identify the next steps, to change their practice, to track, measure and evaluate their progress. And our facilitators use this tool, and we suggest that they use it even on a first meeting with a school, because it enables a conversation around the core business of what a school is doing. And of course, the skill set that a facilitator needs in order to be able to conduct those conversations is an understanding of critical questioning and being able to have challenging conversations. So again, you'll see at the bottom of the slide, I've provided you with links to 2 schools and how that they have used the rubric, as well as the role of the facilitator as a critical friend, as a springboard for change within their school community. And so how schools have used the health and wellbeing for learning approach and rubric, what their feedback has been is that they loved it because it saves them time, because they don't have to come up with their own tool. Here's a tool which in one foul sweep allows them to review absolutely everything that they do, including the outcomes that they're achieving within their school, and integrating a health and wellbeing lens. It's like wearing a health and wellbeing pair of glasses and looking at everything that's happening within their school community. It provides them with a school that they can scope health and wellbeing for learning, not only for their individual school, but they can also use it across a group of schools if they wanted to. And it enables them to monitor and evaluate their progress and use an approach and tools that have been proven to drive significant improvements in student outcomes, as provided by our evidence that Dr. Heidi Leeson provided for us. So in summary, what we've been able to show and prove is that the health and wellbeing approach does have an impact on educational outcomes. It was an independent analysis that found for us that 29% of the improvements in reading, 60% of the increase in attendance, and 42% of the decline in stand-downs and suspensions in health and wellbeing schools within New Zealand can be attributed to the use of the HPS approach. So parents and whānau and students and school staff do have a strong influence on decisions and outcomes, and when they do, for these schools and the schools that take this approach and focus on educationally powerful relationships, it's the strongest driver for students for improving student outcomes, which was a really important take home for us in our schools. So just to recap, we hope that today for you we have covered off for you the difference that we see between health and wellbeing for learning, that is the approach to health promoting schools that we use in New Zealand, and how that differs from generic health promotion or health education. We hope that we have defined for you community development and how that is central to our approach, and how agency and how the shift in power is important within that. We also hope that we have outlined for you how inquiry is central to our approach, and the tool that we provide enables that inquiry across all aspects of the school. And so it's a whole school approach that we're taking, and the tool provides a lens which schools can utilise to identify where they're at and where they need to go to next. And we also wanted to show you that our approach is based on sound evidence, that our theory for action is based on sound evidence, and that the power of the rubric and critical questioning, the roles that those play in enabling change to happen within a school community. So that's it from us, and I am very aware that poor Donna Wind, who is my colleague, has got up at 2 in the morning to join us and hasn't been able to speak. But she was the person who put together the huge data set that Dr. Heidi Leeson used. So I've asked her to come along so that if you've got any questions around the data sets, that she would be able to answer that. She also helps manage the database with me. So I thought she may be a useful colleague to have here, and I appreciate, Donna, the huge sacrifice that you're making at the moment. Thanks for joining us. Have you got any questions?
Yes, open it up and either type them into the chat box or just click on your mic and go ahead and ask them. We'll be freewheeling. And Donna, maybe if you have a comment or question or an observation based on your work in this project, please jump in and offer that for folks as well.
Okay.
So I'm going to start with one, and it was highlighted a little bit earlier in the previous presentation, but the title of your program is really important to note. It's Health and Wellbeing for Learning, and that's I think it really marks a real shift in your thinking. It was based on Laurie St. Leger's work back in 2011, but as most people on the line will know, I think there has been a global dialogue being led by educators, by ASCD, and by the Teachers Education International. And I apologize for the background noise. I was explaining about our puppy earlier. But anyway, the shift of making it into health and well-being for learning is something that permeates the entire approach here, and I think it's really important to note. And maybe Therese and Annie, you might want to comment on that.
I think it was important to make explicit that it was different from health promotion or health education, and that the purpose, and for schools as well, that the reason that we're in there is to help them achieve their outcomes, that our facilitators were not coming in there and getting schools to comply so that they could achieve their outcomes, their health outcomes. It was really about how can we help you achieve your outcomes. So it really shifted the whole dialogue with the school community.
And before we started using it, there was a bit of confusion from some of the school leaders about why health was going to the schools. And by kind of rejigging the brand, although we still have the word, the acronym HPS, and then we put health and well-being for learning, there was a shift in their thinking, and they knew that we really meant the marriage between education and health.
Thanks. Further questions or comments from folks? Please jump in.
It's Anthony here. I just have a question about funding for schools. I mean, I think New Zealand's unique in perhaps schools being self-governed. And is there any sense about how schools or the Kohoiako prioritise funding for different health topics and health areas?
Basically, they don't receive funding for health. The health funding, the Ministry of Health holds that purse, and that funding goes to the DHBs. It doesn't go directly to schools. They just get an education budget.
The funding that the Ministry of Health provides to the District Health Board is to be able to employ the facilitators, and the DHBs do not give any financial resources to the schools as they do their health and well-being for learning work.
Okay. So if grants are available for health learning schools projects within schools, that's really coming from health, not from education. Is that the right understanding?
No, there are no grants. There are no grants either being provided by the district health board to the schools. They are provided with a facilitator, and the facilitators also is the conduit for the school with health education and social services.
Oh, okay. Okay. Thank you.
I think that's a really interesting issue, not only a question, but because of the health system being funded by health topics primarily, as things ebb and flow in a health ministry traditionally, it's the issues that are driving the agenda, and of course it'll be changing over the years, but it is all about the issues, and the funding is often, and the structures are often focused on that. So making a shift to where the focus is on learning and health is a way of getting there, the other way around, that learning, more effective learning and attendance and so on in school is a way of getting to better outcomes for health and well-being and agency, is quite a significant conceptual shift. And that's the challenge for us, I think, moving forward. And putting it into a kind of into an example of a document, there are lots of health promoting schools checklists and self-planning guides and self-assessment tools that are often make sure they cover some topics. But if we are going to the sort of other countries that often have, most countries do have school improvement processes and planning, by infiltrating that process with the rubric kind of a tool and the dynamic of critical questioning and so on, is a way that it takes it away from being a separate thing. It actually becomes part of the educational process, and that would be, I think, quite a dramatic shift too in the thinking and the process is often used by health ministries and even health and education ministries working together, where checklists and things are. And I'm one who's done a lot of checklists where it's all about the topic and the program rather than about how well kids are learning and staying in school. Maybe.
One of the key things we find too is within New Zealand is that school leaders make assumptions. So if you talk to just the school leader and talk to them just about health and well-being, they go to a whole lot of default stuff that they read on the media or whatever. So they'll say that healthy lunch boxes or physical activity, but often there's not a great deal of evidence for that. And our challenge for them is, so when you talk to students and their parents, what do they say are the key issues for them? And we know that very often they've never asked. And when they do, generally, that is not the top of mind for parents and students. There's other things that surface. They may have, and they often get to eventually get to physical activity, but it's through activating their voice and enabling them to act and be actors in addressing health and well-being that you really get shifts. And we've got an example, and I haven't shared that, but I will provide that for you. And Annie mentioned at St. Pius School, where the principal was very brave. She wanted to improve outcomes for Pacifica students, so she got the Pacifica parents together and said, look, what do we need to do? And they said, leave it with us and just provide us with the space and we'll get things happening. And what she thought they were going to do was run a homework centre. But what they did was they ran all sorts of things. They had they got cooking classes, they had family activity and physical activity sessions that they ran, and they were so popular that all the other groups within the school wanted to come and join them. And they led it. They got the other whānau and families on board. They ran a Facebook page. I mean, within 2 months, it was hugely popular. And other schools heard about it, and they wanted them to show them how they did it. So, and of course, at first she was a little taken aback and thought, oh my goodness, what have I done? Because they were asking if they could utilise some of the facilities after school and that kind of thing. She thought, there was a little bit of hesitation, and she thought, what am I doing here? You know, what happens if something goes wrong? But nothing went wrong. In fact, it went very right. And that is certainly our experience, is that once schools allow parents and students to have a voice and then are prepared to allow them to act upon it, you get really big and effective change happening.
Great. Further comments or questions? We are running almost 20 minutes past the hour here, so maybe we can start to close the session. And maybe a caution and a comment from this. This is a very powerful example of how to best work within school systems, and as many will appreciate, going to New Zealand is going to be something we might want to do. The IUHPE conference is in 2019 in April, is in New Zealand, and we'll be working with Therese and Annie and Donna to organize a session that will really look into this theme in depth. So we're hoping that if you are looking for your travel budget for about a year and a half from now, maybe you can think about joining us there. But I do want to say that going back to Anthony's point, the health systems have their own legitimate power structures, and it needs to be a careful and incremental negotiation of making changes or adapting and aligning things differently. It's not about just saying this is the better way to go. It's about persuading the whole system, and it's not just the leaders of the system. It's at all levels in the system to think about doing things differently in a way that's compatible with what we've heard today. And that's going to take time and a lot more awareness about how systems work. And so that's hopefully one of the, this is a light at the end of the tunnel, or an aspiration or a goal that we can aim for, and it is both both a goal and a practical example of how it's worked. So again, thank you to our presenters who have stayed up to an ungodly hour on their day today, and we'll be in touch with the subsequent sessions as part of this series. Therese and Annie, any other further comments before closing up? I'm not hearing any comments, so I guess we'll work towards finishing up the session and turning off the recording in